Welcome. Today we are talking about the World Diabetics Day. Today, 14th November 2022, is World Diabetics Day with the theme Access to Diabetic Care. It is marked every year on the 14th of November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. What is diabetes? Diabetes is a chronic disease which occurs when the pancreas does not produce enough insulin and when the body cannot effectively use the insulin it produces. This leads to an increased concentration of glucose in the blood. This increased concentration of glucose in the blood is called hyperglycemia. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is when the insulin is either called insulin dependent or childhood onset diabetes, which is characterized by lack of insulin production. The type 2 diabetes, which used to be called non-insulin dependent or adult onset diabetes, is caused by the body's ineffective use of insulin. It often results from excess body weight and physical inactivity. Gestational diabetes is hyperglycemia that is first recognized during pregnancy. So today, diabetes affects more than 500 million people around the world. Almost half do not know that they have it. This puts them at risk of life-threatening complications. Some of the life-threatening complications of diabetes are heart attack, kidney failure, liver damage, lower limb amputation, sexual dysfunction, stroke, and vision loss. 1 in 10 people now live with diabetes. The risk of diabetes is putting health systems under increasing pressure, preventing people with diabetes and those at risk from getting access to the care and the education they need. Let's look at the common warning signs of diabetes. They include blurred vision, excessive thirst, unintentional weight loss, frequent urination, lack of energy, slow healing wounds, frequent infection, tingling or numbness in hands and feet. These symptoms can be mild or absent in people with type 2 diabetes. There are some of the risk factors for type 2 diabetes. It includes a family history for diabetes, unhealthy eating habits, lack of physical activity, being overweight, age, high blood pressure, ethnicity, a history of diabetes in pregnancy, poor nutrition during diabetes. For more than 95% of the time, people with diabetes are looking after themselves. They need to understand their condition and keep their diabetes knowledge up to date in order to be able to manage it. 9 people will be living with diabetes by 2030. Almost 1 in 2 people with diabetes are undiagnosed. So if you are above 40, if you are 40 and above, you may be at a risk for type 2 diabetes and should be tested. And then if nothing is found, you should be tested at least every 3 years. If you have risk factors that increases the likelihood of developing type 2 diabetes, then you should be tested more frequently. Diabetes has become a significant global health challenge to the health sector and well-being of individual, family, and society. So, and because of this, there are actions you need to take to be able to manage the signs or to manage type 2 diabetes. You need to practice healthy diet, regular physical activity, maintaining normal body weight, avoiding tobacco use. So Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, regular screening, and treatment compliance. So, as we are getting older, you need to be screened. You need to go for screening of diabetes. And once it's found, you need to make a change in your diet. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos as they drop.